What if I told you that your blood pressure reading at the doctor's office might not tell the whole story? In fact, some people have normal readings at their clinic visit, but higher blood pressure the rest of the time. Others experience the opposite. That's why we often hear patients ask, "Do I really need to check my blood pressure at home?" And honestly, that's a great question. For years, most of us have only had our blood pressure checked during doctor visits. Usually a nurse or medical assistant checks it before the appointment. And for many people, that's the only reading they ever see. But here's something important to know. Blood pressure readings taken at home or outside the doctor's office are actually better at predicting your risk of heart disease, stroke, and other cardiovascular problems than readings taken in the office alone. And there are a couple of reasons for that. First, there's something called white coat hypertension, sometimes referred to as the white coat effect. You may have heard of it before. This happens when your blood pressure is higher at the doctor's office than it is during your normal daily life. For some people, simply being in a doctor's office can cause feelings of stress or anxiety, and that can temporarily raise their blood pressure. As a result, the reading you get in the clinic may not accurately reflect what your blood pressure is usually like throughout the day. That's one reason why checking your blood pressure at home can be so helpful. The second reason is something called masked hypertension. You can think of masked hypertension as the opposite of white coat hypertension. With masked hypertension, your blood pressure appears normal when it's checked at the doctor's office. But once you return to your normal daily routine, it may actually be much higher. And that's important because unlike white coat hypertension, masked hypertension can significantly increase your risk of heart disease, stroke, and other serious health problems. That's why checking your blood pressure outside of the doctor's office is so important. It gives a more complete picture of what your blood pressure is really doing throughout the day and helps identify high blood pressure that might otherwise go unnoticed. When we talk about checking blood pressure outside the doctor's office, there are two main ways to do it. The first is called 24-hour ambulatory blood pressure monitoring. Your doctor may order this test to get a better understanding of what your blood pressure is doing throughout the day and night. During the test, you'll wear a blood pressure cuff for 24 hours, and it automatically takes readings every 15 to 30 minutes throughout the day and night. The cuff is connected to a small portable device that records all of those readings. Once the test is finished, your doctor can review the results and see your average blood pressure over the entire 24-hour period. This can be very helpful because it gives us a better picture of what your blood pressure is doing throughout the day and night. Another option is home blood pressure monitoring. In fact, it's highly recommended by the American Heart Association, especially for people with high blood pressure or a history of hypertension. Now, there are different ways to check your blood pressure at home, but the most important thing is to make sure you're doing it properly. It's generally best to check your blood pressure at times when it tends to be highest, which is often in the morning and again in the evening. Before taking a reading, sit quietly for about 5 minutes and give your body a chance to relax. You'll also want to avoid things that can temporarily raise your blood pressure, such as drinking coffee, smoking, or exercising right before you check it. And here's something many people don't know. A full bladder can also raise your blood pressure. In fact, it can increase it by as much as 10 to 15 millimeters of mercury. So it's a good idea to use the bathroom before taking a reading. These simple steps can help you get a more accurate reading at home. And that's important, because if the reading isn't accurate, it could lead to the wrong decisions about your blood pressure treatment. Once you've correctly measured your blood pressure, the next question is, how often should you actually check it? The answer really depends on your individual situation, and it's something you should decide together with your doctor. In most cases, when you're starting or adjusting medications, it's usually recommended to check your blood pressure about 3 to 5 times a week. Once things are stable and your blood pressure is well controlled, you can usually scale that back to a couple of times a week, or even less, just to make sure everything is staying on track. The good thing is that many home blood pressure monitors today can connect to apps or electronic medical records, making it easy to share your readings directly with your healthcare provider. So instead of guessing, it becomes a clear conversation based on real numbers you're getting at home. And at the end of the video, you can check out the 5 best Omron blood pressure monitors we recommend. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.